Some years ago I had a parcel arrive from the playwright Nell Dunn, and in this parcel was a whole lot of transcripts of conversations she'd had with doctors and nurses and carers and patients, all connected with cancer. And she asked me if we could work together to try to turn this into a play. So we did, and we got some actors together and we workshopped it. And then Nell went away and wrote the play Cancer Tales. And Cancer Tales is a verbatim piece. The stories are true, they're real people, and it's told in their words. And what Nell has done is to edit these stories together. And she picked 5 stories from all this material, which is the stories of 5 remarkable women, and they're all different stories about cancer. Well, we put this on at a theatre. We never thought it would be popular or anyone would particularly want to see it, actually. And then we were asked to present it at a conference, at a medical conference. And there was all these kind of very hardened professionals there, and I was worried that she hadn't done her research properly, and I wasn't sure how it would go. But it went really well, and the response was amazing. And from that day on, we've been asked over and over again to present it at conferences. It started to be used in training, and a number of hospitals used the script as part of their kind of training program. And then a pharmaceutical company picked up on it and republished the play as a workbook. So the text is on one side, and then there's advice from doctors and specialists on the other side of the page, as it were. And that workbook has become very popular and won a number of awards. And the play seems to go on and on. So we're very happy to be here today at your conference presenting. We're just going to present 2 of the stories today. And I think it's important that we do this work because it does raise issues about communication in cancer care. And we find particularly interesting are the discussions we have after the show, because I think everybody's lives are touched by cancer. So we hear fantastic stories from people in the audience, from doctors and oncologists, but also from patients. So it's been a really worthwhile project. As I said, I mean, everybody seems to be touched by cancer. When we first got the first cast together, we found everyone had their own cancer story. My father had just died of cancer, and my mother died of cancer while I was working on the show. And somehow it seems to help. Just talking about the kind of issues involved from the patient's perspective particularly seems to affect doctors quite a lot. And we've had a number of doctors who have written to us, or hospitals that have written to us and say that they've changed their procedures, or it's really changed the way they look at cancer care. And I think that has been really rewarding. And I hope today that it will have the same effect, that people in the audience will start to think about the issues slightly differently.